Hello all, welcome to Megha Hiremat YouTube channel. In today's video, I am going to tell you the parts and significance of this stethoscope. So let us proceed. As a medical student in any of the medical field, it's must to know about this. So let me start. This part is called earpiece, and remaining this part, this total part is called the chest piece. Okay, now let me tell you the sub parts. So this is ear tips, both are ear tips, and this is ear tube, and this is called tubing. This is called tubing, and this is diaphragm, and this is bell. Now I will tell you the significance. Okay, so now I will tell about this ear tips significance. So ear tips are, these are plastic or silicone buds at the top of the stethoscope that rest in your ear. Most stethoscope come with 2 or 3 different sizes of ear. Picking the wrong size can affect the sound that you hear in the stethoscope. So a size too small can impair the sound quality, and a size that is too big can irritate your ears. So you have, while purchasing the stethoscope, you just see the size and take. Okay, so if you find that the earpieces that come with your stethoscope aren't comfortable or don't fit properly, there are several companies that sell ear tips of different shapes, sizes and materials, so you can buy those. Okay, so now I am going to tell about this ear tubes. So these are ear tubes, as I told you. So these are ear tubes. The ear tubes are metal piece. This is metal piece that connect the earpiece. So it is connecting the earpiece, right? So that connects the earpiece to the tubing of the stethoscope. So it's tubing of the stethoscope. This is tubing, this is earpiece. So this part, ear tube, will connect both earpiece and tubing of a stethoscope. Then this is a part of stethoscope that is responsible for holding the ear tips and providing the left and right pathway for sound to travel through. And they contain tension springs that rest between the ear tubes. These springs enable you to adjust how tight your stethoscope is sitting on your ears by either pulling the ear tubes together or pushing them apart. You must adjust the tension to make proper seal, but not too much, because you don't want it to be uncomfortable during use. So this is all about the ear tube. So next part, now we will go about this tubing. This is called tubing system. So this is tubing. There's a lot that goes into tubing of a stethoscope. Other than pretty colors and designs, the tubing plays an important role in facilitating how the sounds travel from the chest piece to your, from this chest piece, as I told you, this part is called chest piece, to your ear, how the sound goes. So this tubing will help in that. Stethoscope tubing is typically made of PVC, and it can have a single lumen or double lumen, it depends. So single lumen stethoscope have one tube that connects directly to the chest piece or splits into left and right sides. So double lumen stethoscopes, on the other hand, have two individual tubes. When choosing a stethoscope, you want to pick one with tubing that is thick enough to block out external sounds. So while picking the stethoscope, make sure that it is blocking the outside voice or a sound. If tubing is too thin, it can impact the quality of sound that you hear. So that is important, make a note. So tubing length is also important in general. It's best to select tubing that is 25 to 35 centimeter. So this tubing length is there, no? So it should be 25 to 35 centimeter at least. And also tubing that is shorter than 25 may not allow you to, if this length is shorter than the 25 centimeter, may not allow you to auscultate the patient from comfortable distance. Okay. Then, however, if the tubing is longer than 35, this too can diminish the quality of sound that you hear. If it is more than 35 also, it will diminish the sound that you hear. So you can often purchase replacement tubing rather than investing in a whole new stethoscope. You can just, if you feel like this is not good, you can just invest on this part. Don't buy a new stethoscope, just buy this tube. Then coming to the chest piece, I said no, this part, whole part is called chest piece. The chest piece is sometimes referred to as the head of the stethoscope. So this part is called the head of the stethoscope. It's the part that is placed on patient's body in order to hear the sound during auscultation. The chest piece is made up of 3 parts. So this is stem, this part is stem, and this is bell, and this is diaphragm. Total this is called the chest piece. Dual-sided pieces will have both a diaphragm and a bell, while a single-sided chest piece will only have a diaphragm. So, modern stethoscopes typically have diaphragm and bell that are made up of metal base that sits around the plastic. This is plastic disc. Okay. So now diaphragm. About diaphragm I will tell now. So when placed against the patient's skin or clothing, the sound produced by patient will have plastic disc that it is this wire that vibrates responsible for creating the sound that you can hear through the device. So diaphragm are larger in diameter. So as compared to bell, this diaphragm is larger in diameter. Pick up high frequency noises such as breath sound. The bell on the other hand, this bell is there, no, smaller and picks up lower frequency noises such as hard murmurs, lub dub. So, and then because bells are smaller in size, they are also often used to listen to the breath sound also. Now coming to this stem part. The stem is metal piece. This part is called stem, not this. This is tubing, this is stem. The stem is the metal piece that connects the diaphragm and bell, this part. So totally this part. I hope this is visible. This part is called the stem. This stem is a metal piece that connects the diaphragm and bell. It connects the diaphragm and bell to the tubing. If you own a dual-sided stethoscope, this part will enable you to rotate the head of the stethoscope and alternate between using diaphragm and bell. Some companies sell stethoscopes with diaphragm and bell that are made up of hypoallergenic and non-chill materials to increase patient comfort. So some companies are providing these facilities, so just go for those. And please do subscribe my channel and share the video. Thank you.